next presenters are Professor Grasso, Dr. Cordella, and Greco from University of Roma, Italy.
Can you show me how to switch screens? Yes. Okay, good morning, everybody. I'm Dr. Greco, and I came from Sapienza University in Rome. I'm glad to be here, and I would like to thank APPAC committee for having invited me to participate today. Well, I would like to present you a research that we performed in Rome, and we would like to understand the influence of professional training on culture, of professional training culture and rehabilitation process. Okay, first of all, I would like to tell you to talk about our purpose. The purpose of our study is to understand which areas were in need of development in vision rehabilitation service. I know that will change a little bit from other intervention, but we were interested in this particular disability, and because we would like to improve services that work in that field. Okay, let's give some definition. Visual impairment is a significant loss of vision loss that is not correctable by refraction or treatment. That means that is a great challenge for those professionals who works in that field because there is no cure. Visually impaired people experience a wide range of behavioral restriction that result in loss of independence. And more often, it is associated with a loss of social and economical status for visually impaired people and for their families as well. Okay, let's talk about some economical data because the financial problem is very important for us. We have 300,000 individuals that are legally blind, but visually impaired people are almost 1.5 million. That means that almost 2% of Italian population have an impairment. So let's talk about financial. The cost of visual impairment is 9 billion euros for benefits. That means 0.6% of GDP, gross domestic product. But if we consider the loss of productivity, it rises to 36 billion euros. That means that is multiple, from 0.6 to 3% of GDP. It's a very high percentage. So being effective in rehabilitation is not morally valuable, but it has also social and economical importance. So what vision rehabilitation service can do for visually impaired adults? Okay, their mission is to facilitate reinstatement, addressing restriction, enhancing independence, and facilitating employment. Okay, well, there are many approaches, but mainly it involves provision of aids, device, and training to enhance use of residual abilities. Therefore, it aims to provide the patient with skills and resources to manage the practical, social, and economical consequences of their visual impairment and to seek specialist support when needed. Well, we asked ourselves which were the factors of success in this kind of services. Literature shows us that patient active role in the process is one of the most important ones. That means that professionals should motivate their patient in taking active role and helping them to manage their own condition and to develop problem-solving skills. Okay, but the problem is that professional representation of their patient determine their attitude and practice, and therefore it influences the possibility to have a more effective working alliance. Representation are built in different contexts: social, training, and working ones. And their interaction between professionals that work in the same service build a particular representation of visually impaired patient that can facilitate or hinders the patient becoming active into the process. So we asked ourselves which representation of visually impaired adults characterize visual rehabilitation professionals. Let's just spend a few words about methodology. We asked a very important center in Rome to participate. This center worked since 1860 on visual impairment, so it's 1.5 century. And now it's a part of regional health service. And it was very interesting because all professionals accepted to participate to this study. So we performed an open-ended interview, asking them to talk about their professional experience in the rehabilitation process, of the rehabilitation of their impaired patient in this center. All the interviews were audio taped and integrally transcribed. And text underwent a text analysis performed with a software package called TLab. Just I skip here because it's boring. And that are all the passages we should do to get to cluster analysis that allow us to have the outcome, allow us to have group of lemmas which has a high between and within variance, and that allow us to have words that reflect the way professionals represent their professional function, their patient, and the rehabilitation process. So here is the outcome. Well, it's colored. So it's a three-dimensional that I split into graphic to have, help you to understand. We find out 4 clusters. Because of professionals, variety in this center, we grouped professional we divided them in 4 groups depending on professional training context. So we found out 4 professional groups: physician, paramedical, psychosocial worker, and visually impairment professionals. All of them came from different professional training contexts. As you can see, this is the cluster distribution. For physician, we have mainly cluster 1 and 3. For paramedical, we have especially cluster 3. For social worker, psychosocial worker, and visual rehabilitation professional, they have an equal distribution of cluster, but because since cluster 4 is mostly represented in visual rehabilitation professional, we think that it characterizes this group. So to help you understand the group of lemmas, we gave them a name just that reflect a little bit the way those professionals represent their function and the target. So cluster 1 is management. Professional functions focused on management and coordination. Their target is multidisciplinary team of professionals. That means that focus is oriented on the team and not other disability related with visual impairment. So the target is the multi-handicapped child. And rehabilitation is focused on multi-handicap and not on visual impairment. Cluster 4, advocacy, was mostly presented in visual rehabilitation professionals. The professional functions is to help learning process, and the target is scholars. So, but in this cluster, professionals substitute their patient in their function. Do not build particular skill so they can be self-sufficient. So what was very interesting is that any cluster presents a lemma connected with visually impaired adult. So that's very interesting because there is no possibility to perceive the blind person as independent, productive, self-effective, problem solver. That should be the product of this center and of their service. So visually impaired patients are represented as passive, unproductive, dependent, unable, as you have seen in the cluster before. Well, I think that it could help us to make some consideration because, as a colleague has been said just before, mostly in this center, in these services, there are a very high percentage of healthcare professionals. So let's make some consideration between cure and rehabilitation. Cure implies professional performance. Then patient passivity facilitates the process. Patients should rely on professional ability to take care of them. But rehabilitation implies patient performance, and therefore patient passivity hinders the process. So patient passive representation limits rehabilitation process effectiveness. Well, we have a superhero, and I don't remember the name. So visually impaired patient, because it hinders motivational process, and although patient management of his self-condition, so he never be independent. He should be always connected with the service. He never get out. So, well, we think that this study suggests that work should be done in training context, aiming to develop a more functional visually impaired patient representation. And I think that psychologists can work on representation. So I think that they could help professionals in building a more effective working alliance, working on representation. And I think also that they can work in patient so that they can use the service to be independent. Let's have just a final practical conclusion. I think that it could be very useful for professionals who works in that area to consider visually impaired adults as a partner more than a patient. Thank you.